Hi Mira. Hi Mira's mom. How are you?
Good. How are you?
Good. My name is Trey. I'm a student physical therapist assistant and I'll be working with you guys today, okay? So I see in your chart, Mira, that you're a runner and you've been recently diagnosed with exercise-induced asthma.
Yes.
Okay, awesome. So what we're gonna do right now is I'm gonna educate you both on exercise-induced asthma, about what it is, how it's diagnosed, signs and symptoms, as well as some education on how you can help her, Mrs. Gonzalez, get through exercise-induced asthma. And then, Mira, we're gonna focus on things that we can do to help you breathe better, and lessen the symptoms that you have when you run. Does that sound okay?
Yeah, sounds good.
Okay, so we'll get into it. What is exercise-induced asthma? So it can also be called exercise-induced bronchoconstriction. There's another name you might hear for it. So it's a narrowing of the bronchial tubes of your lungs when exercising. So the bronchi are kind of like two tubes of passageways that go into the right and left lungs that connect to your windpipe, or you probably know it as the trachea. So children with this condition like you typically have quick, shallow breaths while playing sports, and it's mostly breathing through the mouth. This then causes the air from being warmed and humidified because it's not going through your nose, and so this causes the airways and the bronchi to constrict or just become smaller, as you can see in this picture right here. So then it makes the air difficult to get through your airways and making it more difficult to breathe. So it's more common in children that have already been diagnosed with asthma or have allergies or eczema. And it can also be caused by cold air and allergens. Does that sound straightforward?
Yeah.
Okay. So common signs and symptoms of this condition may include coughing, wheezing, shortness of breath, chest tightness, and fatigue. Have you felt any of these symptoms? If so, which ones?
Yes. I've felt chest tightness and fatigue, especially after running.
Okay, all right. We can definitely work on that. And these symptoms definitely occur between 5 and 30 minutes of exercise, and they're most prevalent and worse the more intense the exercise is. Do you feel that way? With the more intense the exercise is, that you feel those symptoms?
Yes, the longer I run, the more symptoms I feel.
Okay. All right, and some signs of someone that has exercise-induced asthma: you can get tired very easily, and then when you come indoors after being physically active outdoors, you may start coughing a lot, okay? So we'll get into how it's diagnosed. I'm pretty sure you've done this already based on your diagnosis, what I see in the chart. It's diagnosed with a spirometry test, which is that device that you use that measures how well your lungs function. And so it measures how much you inhale and exhale and how fast you exhale. So a doctor may also conduct an exercise and breathing test that may include physical activity. He may have you run on a treadmill and then do the spirometry test. Do you remember doing that test when they diagnosed you?
Yeah,
Okay. Cool. All right. So medications that are typically associated to treat exercise-induced asthma are usually bronchodilators. And so these open up the airways and the bronchi, which we're trying to do. There are short-term ones and there are long-term ones. The short-term bronchodilators that you use, the inhalers, usually alleviate your symptoms while they're occurring. And then the long-term ones are the ones that you take before exercise, about 30 to 60 minutes. Have you been prescribed those? I see that you haven't had much success with them, correct?
Yes.
Okay. So, you can also have inhaled corticosteroids, which can help with the inflammation of the bronchi, which can occur as well, but they have 2 to 4 weeks before they actually have an effect, okay? All right, now this is for you, Mrs. Gonzalez, and how you can help Mira with her exercise-induced asthma. So one thing you can certainly do is consult and working closely with her doctor to develop a plan around her needs and her symptoms, and ensure that she's still using the bronchodilator, as I still think it'll be effective, and using it as prescribed. Have you been helping her still with that?
Yes.
Yes. Okay.
So the more she uses the inhaler, like the better it's going to be for her long term?
Yes, theoretically, yes. And so we also want to do, which we'll get into a little bit later, is to make sure that she's doing her active warm-up before she exercises or runs, and then just monitor her symptoms and adjust the plan if needed. Does that sound all okay to you?
Yep, sounds good.
Okay. So now we're going to work on what can physical therapy do for exercise-induced asthma. So what we can do with different breathing techniques and physical exercises is open up and dilate the airways. So as you can see in this picture here, this airway is very constricted, it's very narrow. What we want it to do is make it look like this one, where it's nice and open, so this way air can get through easier in and out, okay? So we can do these exercises before you go and before you run. This way we can prevent the symptoms from happening when you run, and we can also do them while the symptoms are occurring, so this way we decrease the severity of them while you're having them. And so now we'll get into a couple of treatments that we can do to help you do that. Does that sound okay?
Yeah.
Are you excited?
Yes.
All right, sounds great.